Welcome back. A long-awaited Alzheimer's drug from Eli Lilly is getting the go-ahead from the FDA. This drug has the potential to help the nearly 7 million Americans affected by the disease by slowing the brain's decline in the early stages of Alzheimer's. NewsNation's Alicia Nieves is here with the details. Alicia, this potentially is huge news. What sets this drug apart?
Yeah, a lot of hope here with this kind of latest FDA approval. This treatment reportedly takes less time to slow down the progression of early-stage Alzheimer's disease as compared to those other two drugs that have come on the market. Now, of them, the first one requires continuous and indefinite use. This one does not. The second was actually discontinued in January because it wasn't as effective as initially thought. Now, the drug approved just this past week by the FDA is chemically known as donanemab. It will be sold by Eli Lilly under the brand name Kisunla, and basically the drug targets amyloid plaque in the brain, which is natural, but a buildup of which is believed to cause cognitive decline and memory loss associated with Alzheimer's disease. Now, an 18-month study done by Eli Lilly, which led to the approval of Kisunla, shows the drug could reduce the amount of amyloid plaque by, get this, 84% in patients in the study. It showed the slowing of overall cognitive decline by 22%. And more importantly here, patients treated had a 39% lower risk of progressing to the next clinical stage of the disease than those who took the placebo. Now, important to emphasize here, this is still far from a cure. It has only been shown to be effective on those with early symptoms of Alzheimer's and can only slow down the progression. It cannot reverse it, but the potential to modify the course of this disease and give people more time has created some excitement.
We have been waiting for so long for positive news, and this being the third now really gives us hope, tremendous hope, that we are on the precipice of really significant change for those that are experiencing the earliest symptoms of Alzheimer's.
Yeah, experts say this treatment really could be the tip of the iceberg here. There are other drugs being tested right now that could lead to some further breakthroughs. A spokesperson for Eli Lilly tells us that Kisunla should be available in just the next few weeks.
Alicia, these numbers are promising, but what do we know about the potential side effects? And of course, we have to discuss the cost here too.
This is where it gets really interesting, right? The approval of Kisunla was delayed by the FDA a few times because of concerns about those risks. We're told they include temporary swelling of the brain and bleeding in the brain. Eli Lilly actually acknowledging 3 deaths in the study related to those side effects, but that was less than 1% of those who were actually in the study. As far as cost here, a year's treatment is expected to be covered by Medicare B, especially for those over 65, which is most people with Alzheimer's. But for everyone else, it's going to depend on their individual insurance. Outright, the cost expected to be about $32,000. But again, with this drug, because it's only needed for a limited time, 18 months in the study, it's actually expected to be more affordable than the other one on the market because, again, that one requires continuous and indefinite use, Hena.
This is good news. Hopefully more research will be done and it'll get in the hands of right people and doctors, of course. Alicia Nieves, thank you so much for that update. Thanks for watching. Go to joinnn.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.